So I got my degree in '92, and back then feeding therapy was not even on the horizon. People didn't know about it. But what was just starting to happen, in fact, I took one of the first classes at the graduate level, was dysphagia therapy, swallowing therapy slash, for the dysphagia with the stroke patients and head injury. And that's where I got my swallowing background from. Everything correlates, so oral motor skills, fine motor skills, gross motor skills, they follow the same continuum. So you wouldn't expect a child who's not crawling yet to be able to pick up or self-feed anything even soft, because their motor skills are not doing what it needs to do to pick that up. So you expect certain skills, oral motor-wise, fine motor-wise, and gross motor-wise at the same level. So you really got to have a strong background in child development and neurology, because a lot of children that we work with, there's other components to it. So we need to understand what's happening and what to expect. Body positioning is a big deal, so that whole physiology piece. And that's where the impact is so important. You've got to get it early. Yeah, and especially, children with autism typically, that, one day they're just suddenly not eating anymore. Happens in about 18 months. It seems to be the window. You want to capture that early, and especially in the preschool years, of getting comfortable around food again. And you want them interacting with it, serving their families, cutting, cooking, stirring, having little mealtime jobs, keeping the mealtime comfortable. And so I do feeding groups with the kids at that age. And that's great, because they're looking at other kids in the group that are doing something they're not. It's kind of the next level. So it's nice to have their peers involved to move them along. Yeah, so kids do have very different eating styles. Some will eat without any issues. They'll eat everything on the plate. Other kids will just take a few little bites and leave. And there are red flags to look for, and it's important to be able to distinguish between problem feeders and picky eaters. The first thing that you really want to know is their nutrition, and are they growing? And that would be the first thing. If they're not gaining weight, we want to start chipping away as to why is this occurring. Is it a GI issue? Is it reflux, poor motility, poor absorption, they're just never hungry? What's their behaviors when they're around food? If they come and they sit and they're comfortable, they eat a few bites, okay, I'm done. Or also, it's typical for some kids, which is a typical growing pattern, they'll eat a little bit and they'll stop. And then a few weeks later, they'll eat a little bit more. So it kind of follows a growth pattern too. But if they look at food and they run away, they look at food and they scream, they're throwing a temper and arching their back when you go to sit them in their chair because they know, oh my gosh, now I got to eat. Those are some red flags. There's something about eating that is bothering them. And you want to look at sensory, you want to look at oral motor. Can they not control it? Is it affecting their breathing? Are they afraid to swallow? Do they like to feel the food? Is there a lot of anxiety at home? There could be other issues that's causing anxiety around food. So finding the reasons why they are not actually taking the food off the spoon, swallowing it, or taking the food off the spoon, chewing it and swallowing it, drinking from the cup, self-feeding. Why is that not occurring? That's the philosophy behind feeding therapy. So we're not teaching them to eat. We all have an innate ability to eat. There's something happening that's preventing that from happening. And that's what we need to address so that we can be able to move forward with them to be able to have a typical diet for brain and body growth. So that's the philosophy behind feeding therapy. If you could pick one goal to work on from the week, talk to your therapist and say, what is the most important? What is it we're trying to achieve? And using the natural environment and the natural setting, a mealtime or a snack, you can. What's really important to remember is that mealtime. You don't want to do anything averse. You don't want them to go into their chair really tense all of a sudden of, oh oh my gosh, am I going to have to put a chewy tube in my mouth, or am I going to have to try food I don't like, or do I get to eat? So oftentimes some kids need to have a separate chair or a separate setting for snack time or practice time, which can be 5 to 10 minutes, and we leave mealtime. So if our goal is to get off of puree and onto age-appropriate foods, we're going to start that as a snack or practice, and you keep doing what you're doing for meals, because nutrition and reducing aversion is the most important. So be really careful. So really just pick one or two things, understand why you're working on it, what you're working towards, so that you can also be aware of how not to regress. It's very individualized, but it's very specific. You're the mom, you're the dad, you're the caregiver, you're the grandparent, you're the one who knows your child best. And if you have any concerns about, being able to latch onto a bottle, being able to gain weight, being able to eat in an adequate amount of time, anything about feeding that just does not quite look right, ask your physician for a referral for a feeding therapist, because they'll be able to really get in and find out why is this occurring. And like I said, that's the goal of feeding therapy. It's not to teach them to eat or get them to eat, it's to find out why, address that, and then play catch up on the skills that they're going to need to be able to move forward.